This month's team brief comes from Good Hope Hospital, and shortly I'm going to be meeting Dr. Arne Rose, who is the Associate Medical Director for the site. Now I'm going to be asking him about the hospital, but also 3 questions about himself. What country does he come from? What's his favourite hobby? And in the style of Danny Baker, if Dr. Rose were to have a sausage sandwich, would he have red sauce on it, or brown sauce, or no sauce at all? And you'll have to wait till the end of Team Brief to find out the answers to these really important questions. Starting as usual with clarity, I want to talk about progress on the Trust suite of strategies. We listened to you over the last few months and you came forward with some very, very helpful views. And you can see in this little jigsaw puzzle here that we've selected 4 priorities after listening to you. We want our services to be safe, to be caring and to be effective, and we want to empower both patients and staff. When we first put this to you, we showed you this triangle that you can see in the diagram here, and we got some strong and consistent reaction from you. You didn't really like the triangle, you thought the language was too negative, and you didn't think it was very patient-centred. So if you look at this chart here, you can see how we've moved from the triangle to the interlocking 4 pieces of the jigsaw to symbolise how we work together and collaborate. We're now using language that is more patient-centred and something that separates safety and care and uses much more positive language. Where do we go from here? Well, over the summer months we'll be continuing our consultative process, both internally and externally, with a view to taking a final draft to the Trust Board in September, hopefully for approval, because then implementation is what will start from October. Moving on now to quality, and I'm really pleased to say that we've had significant improvements in the ED departments, and particularly less queuing of patients in corridors unsupervised. Now there's a number of factors behind this. One of them is increased use of the discharge lounges, the second one is the safer placement policy, and a third one is the introduction of new ambulatory care processes. But the bottom line is that it's safer for patients and staff are happier too, and our performance is beginning to improve. Also on quality, I'm delighted now to confirm the opening of the Quality Champions programme, and we've set ourselves the ambitious target of having 1,000 champions within 2 years. Now that'll be quality champions, innovation champions and engagement champions. And thirdly, we have signed up to safety as an organisation, so we'll be setting in train the processes in order to meet that accreditation. To look now at a couple of our important quality outcomes, you can see from this chart here how we continue to do extremely well on MRSA, just 1 case in the whole of last year and none so far this year. And now onto the C. diff chart, and again a very good start to the year where we just had 7 cases in the first 2 months of the year, and last year we were having 6 cases per month. So that's really good news on infection control. If we look finally at the total harms in the organisation, it was a pretty good month on the whole because we had no never events, no MRSA, 2 avoidable pressure ulcers, 5 hospital serious falls, 5 cases of C. diff and 1 MSSA, but unfortunately we had 24 cases of E. coli, so that takes the monthly total to 31. Now to staff engagement and some cautiously good news to report. We've been conducting staff surveys over the last few months, and one of the questions we ask is, would you recommend Heart of England as a place to work? Now back in the National Staff Survey in December last year, you can see from the chart here that 45% would recommend us as a place to work. That's if you add together the light green and the dark green patches. But then you can see below that we repeated the survey in March, and that figure had gone up to 51%, and we repeated it again in June, and it's gone up to 55%. So that's quite a useful improvement in people that think that this is a good place to work. Now I'm going to talk about some of our key performance indicators, and I'm afraid that month 2 was another month that was not very good for finances. The situation now is that we are £2.9 million behind where we would want to be after just the first 2 months of the year. And if you look here at these charts, you can see our performance on A&E, which again is similar to previous months. We aren't meeting the target, we aren't the worst performer around, but we are on a slowly improving trend, which I hope will continue. Now some developments to report on around our hospitals. At Heartlands, the hybrid theatre is on track to be finished and open in August of this year, and at Solihull the dermatology unit is on track to be open in September. Also at Solihull we're working on the design specification for the urgent care centre that's going to be located on block 14. Good news from the listening events where you asked for the opening hours of cafes to be extended. This is happening at Heartlands, so the main cafes will have extended hours. Now, I know that there are quite a lot of other big building projects that people are keen on, and decisions will be made on those as part of the review of strategy that takes place in September. So I'm sorry that there will be some delay for some of you, but those will be then the decisions made in the context of the whole. Now, finally, two big successes to announce. Congratulations to the Solihull Ophthalmology Department, who have been shortlisted for an HSJ award for the Oriya service for patients with wet age-related macular degeneration. This new treatment is available for the first time at Solihull in the West Midlands, and it's only the second service in the entire country. So very well done to that team. Also to everybody working in stroke. Now that the hyperacute stroke unit service has been open for some time, we've got the first quality metrics, and it's really great to report that it's doing as well as anywhere else in the country. So these are top-notch results, and congratulations to everybody who works in stroke services. Here I am now with Dr. Anna Rose. Anna has been working in the Trust since 2005, since 2007 as a consultant, and in the last 12 months as the Associate Medical Director for this site. So Anna, what are your main roles and responsibilities on this site?
So my responsibility is looking after all the doctors and clinicians on this site, of which we have about 100 consultants working on this site and 250 juniors. I'm also responsible for organisation and running of this hospital. For example, the 4-hour target, as well as some other of the external targets that are given to us by our regulators. And I'm trying to do so in working with the site team, the management team, the ward managers and all the clinicians responsible for their area. In my clinical time I'm also an A&E consultant, like today, and I'm looking after anybody and everybody who needs our urgent help and attention.
I see. And what are the main problems and pressures that you face?
We've seen a large increase in the attendance in A&E in this hospital. The increase rate is up to 4–5% every year at the moment. We've seen a large increase in proportion of the elderly attending, and we've also seen a large increase in ambulances coming to Good Hope Hospital. On some days, these days, we see more ambulances on a day than the Queen Elizabeth Hospital. And what are you most proud of? So I'm most proud of the fact that I work with 3 different teams who are all brilliant in their way. So I'm working with the A&E team who are sometimes under tremendous pressures, and I like the way that they can respond to all the pressures that they're under and still do a brilliant job. I work with the senior management team as a manager in Good Hope Hospital, and again they are a brilliant team. They come up with brilliant ideas all the time about how to improve the care for our patients here at Good Hope Hospital. And then last but not least, I work with all of the clinicians and all of the nurses and everybody else who works here at Good Hope Hospital in trying to get this place running and to make this hospital a better place for patients and for staff.
And now for 3 personal questions. First of all, which country do you come from?
So most people think I'm from South Africa, but I'm actually from northern Germany. And I've lived in the UK now for 17 years, and my accent has morphed into a mixture of German and Brummie, I think.
And secondly, what's your favourite hobby?
So one of my hobbies is cycling, because cycling is good for my back. And I've just finished a bike ride from Ipswich to the Baltic Sea, which I did in 8 days.
That's really impressive. But now the most important question. If you were to have a sausage sandwich, would you have red sauce on it, brown sauce, or no sauce at all?
Red sauce.
That's the right answer. And that's the end of this month's Team Brief.